So I am honored to be able to introduce tonight's speaker, Dr. Amelie McAndrews, who will present Sinking Your Teeth into Equine Dentistry. Dr. McAndrews is a graduate of Michigan State University College of Veterinary Medicine, class of 2009. After an internship and time as an equine general practitioner, she founded her dentistry exclusive practice, Garden State Equine Veterinary Dentistry, in 2015. Her practice is based in New Jersey. She completed an equine dentistry and oral surgery residency and became board certified in 2022. Besides managing her practice, she is a clinical associate at the University of Pennsylvania's New Bolton Center, where she manages the dentistry caseload. So welcome, Dr. McAndrews.
Hi all, thanks for having me. I have MSU holds a soft spot in my heart. I have also an undergrad degree from MSU. I was an animal science major, so I spent a total of 9 years in East Lansing, and I met my husband. I'm not from Michigan, I'm from Connecticut, but I met my husband at MSU and I dragged him back here with me to New Jersey. So a part of me will definitely be always and from Michigan, or even though I'm not from Michigan, but a part of me will always definitely be at MSU. So I'm happy to be able to share this with you guys. Very grateful for the education that I received from my alma mater. So I'm really excited to share with you guys a topic that's obviously very near and dear to my heart and something I get really excited about. So excuse me if I'm getting a little too excited here. And then also, please, if you have questions as we go, feel free to use that Q&A function. Dr. Strakota will let me know if there's something, if a question comes up. And then there's also going to be time at the end. So please stop me if you have any questions. So without further ado here, oops, I gotta use the arrow here. So first of all, just a little warm up here. So what is the purpose of having a dental performed? Is it A, to float the horse's teeth to remove sharp points? B, to do a thorough oral exam, or option C, which is both A and B, so a thorough oral exam followed by floating teeth. And you can use, if you want to use the chat function, if you want to go ahead and vote on which one of those you think that it might. Oh wait, let me there. Let me know where, which one of those options you think it might be. I don't know if you guys have a chat function. Can folks see a chat function?
I see some answers coming through the Q&A.
Okay, that's fine. Well, we can do that. What are our thoughts from the?
So far, we have all C.
All right. That's good. Well, you guys, yeah. So you guys are pretty smart here. So the option, it is option C. It's a thorough oral exam, followed by floating teeth, and we're going to talk about why as we go here. So just as I was getting to in that last slide, equine dentistry has come a long way these days. It's not just floating teeth. I know folks used to think that that's all it was, and that's sort of what it was reduced to, but we have so much more than just floating teeth, and hopefully you guys will understand a little bit why as we go through this. An oral exam is really important. We're going to see why. You can see the difference in the image on the left there when that dark mouth, but versus looking on that fully illuminated mouth. So we're going to go over why that is and what you can see here. So in overview, we get asked commonly, like, why is dentistry important? My horses in the wild don't receive any dental care. So why does my horse need any dental care? Why should I care? So first of all, horses in the wild, as you can see, they live that example picture there. They're living on this plain. They're eating this really rough forage that they're grazing all day. So their diet is very different than the nice soft grass, hays, and pelleted feeds that we feed them. They're spending a large part of their day chewing and foraging, and they're eating a really poor quality forage. So that means they're going to wear their teeth differently than your horses eating that nice soft hay and pelleted feed. Then there's also natural selection, which happens in the wild here. Horses like this one with the overbite here is probably not going to be able to grind that rough food, that rough forage so well. So that horse's lifespan is going to be shortened. And in general, horses in the wild have a much shorter lifespan than our domesticated horses do. So when a wild horse can't chew its food anymore, then that's the end of its lifespan. It's not, and that happens at around 15, 17, somewhere around there. I know, and I'm sure a lot of you own or work with horses that are in their 30s and still doing great. And that's because of good dental care and the good diets that we have and other medical care that we're able to provide these horses. So again, the bay horse there on the left, that's Bud. He's one of my patients. He's in his 30s. He has zero functional teeth. But as you can tell with the good diets that we have these days and his owner's diligent care, he looks great even though he's in his 30s with no functional teeth. Then the other horse in the double bridle, we're not asking wild horses to go to piaffe and passage and high level movements, jump large fences. So we ask a lot more of our horses these days, and good dental care or dental problems can affect performance. So dentistry is important for our performance horses. So, as an overview, dentistry is a team approach. So this is one of the reasons why it's important to have a veterinarian be your dental provider, because dentistry sort of overlaps with all these different facets of equine medicine, whether it's general practice and managing a horse that has dental issues and it has Cushing's or PPID, whether it's a sports medicine, again, a horse that's having a potentially subtle performance issue, it may be a dental cause. A horse that has a sinus infection may be a potential dental cause. So knowledge of the sinuses and how to deal with a sinus infection. Surgery, there's complex dentistry cases that require surgery, or the picture on the bottom left there, that horse had an oral tumor. So sort of knowledge of all these different facets of equine medicine is important. It's easy to get very focused on just the head or just the teeth, especially when that's all you do. But keeping in mind that the horse's head is attached to the rest of its body, and there's a lot of other important issues that can show up as dental disease, but relate to the rest of the horse and require a really holistic approach to treating that. So we're going to go over an overview here. So we're going to talk about some basic oral anatomy. We're going to talk about a what and why of oral exam and floating. Then we're going to talk about, as we go over oral exam, we're also going to talk about some common problems. And then we're going to talk about some signs of dental disease. So as an overview here, we're going to talk about the different types of teeth here. So in the front of the mouth are the incisors, and that's what you can see when you flip their lip up, when you're putting the bit in their mouth. And if you can if you see their incisors is just a really small part of their mouth here. The majority of their mouth goes much further back than what an owner is able to see by just flipping up their lip. So we have incisors. Then this skull was a mare, so she didn't have any. But then we have canine teeth. The canine teeth are kind of near the bit. So if a horse has an issue with its canine teeth, it can affect its comfort with a bridle. Then moving back, we have, and by the way, there's a total of 12 incisors, up to 4 canine teeth, either 0 to 4 canine teeth. And then we have premolars is the next section we call these cheek teeth. This is what the horses use for chewing. The incisors, by the way, are used for prehending or grabbing their food. And then the canines are there. The reason why they're there mostly in geldings and not usually in mares is because they are actually used for fighting. And then we have premolars, and after the premolars, we have molars. So those premolars and molars together are called cheek teeth. This is what horses use to actually grind their food. Horses can do just fine with no incisors. They can use their lips to prehend or grab their food, but they need their molars and their premolars to actually be able to grind. So, and then they have a total of three premolars, three molars. So it's a total of six in each quadrant. So times four. So that's 24. Sorry. So they have 24 molars and premolars total. And then this skull doesn't have it, but this little called the first premolar, or that's the wolf tooth. Wolf teeth are often extracted when horses are young, and they should definitely be extracted if they have blind or wolf teeth that don't completely erupt through the gums. But not all horses necessarily need their wolf teeth extracted. But if they have them, this is where they are. They're little vestigial premolars. So this is what a wolf tooth looks like. If they have it, where that arrow is, it's just before their premolars. And in the x-ray here, this is actually a blind wolf tooth. So what that means is instead of that wolf tooth erupting down through the gums, it erupted sort of parallel to their maxilla or their upper jaw there, and it didn't go through the gums. So those can be problematic because they can pinch between the bit and that soft tissue and can cause some performance issues potentially. So they can be a subtle finding, but that's where they live. So then another important thing to remember about equine anatomy is horses have what are called hypsodont teeth. So that means they are long crowned tooth, so they're big teeth that erupt gradually throughout their life, though the supply isn't endless. So they're born with a set amount of tooth that develops as when they're young, and that tooth gradually erupts into their mouth. But when that amount of tooth is finished erupting, then that's it. There's no more. So that's another reason why dentistry is important, is we want to preserve the life of that tooth so that it lasts for as long as possible. So on these two skull specimens, the top one there is a young horse. So if you can, I'll remove the lines there. If you can see this whole thing, this is the length of the tooth in this young horse. That's where I have under the red line there. You can see how tall that is versus this skull on the bottom is an old horse, and the length of his tooth is the same as those lines. So you can see the difference in the length of the tooth. Also, in the picture that I have here on the right, you can see again a young horse tooth versus an old horse tooth, how short that is. And it's pretty cool. Teeth should erupt a few millimeters, about 3 millimeters a year. So you can sort of do the math and see how long that would last. They usually start to wear out their teeth, usually when they're approaching 20, they're starting, or around there, they're starting to wear out their teeth. So that's going to affect how they're able to, if they're able to masticate or grind their hay, if these teeth are starting to get worn out. So there's a lot of words and lines on this screen, but I just wanted to show you guys the anatomy of the tooth is actually quite complex, even on the oral. This is a view of the oral surface of teeth. So when we're doing an oral exam and when we're examining a tooth, we really need to look at all these different aspects of the tooth and make sure each one of these parts does not have any fractures or signs of disease to it, that it's all intact and that it's looking the way it should look. So this is one of the many reasons why we need a very detailed exam with sedation and a speculum and a mirror to be able to examine all these different very subtle parts of their dentition. This also, so I think this is pretty neat. So their teeth are living structures. They're not just they're living structures. They're not just stones. Floating actually is a masonry term, but we'll talk about that more later. So that this kind of tentacly looking structure, this is the pulp or the live part of the tooth. In here is the blood supply. It's the brain, the heart and brain of the tooth. So the blood supply is in here, the lymphatic system, the like there's nerves in here. These are all very important structures of the teeth. And this was actually pulled out of this specimen. This was a young horse. This tooth was abscessed. So if you can see, you have to keep in mind, this is important. If a tooth fractures or if too much tooth is ground down, you can get into this blood and nerve supply, and obviously can cause pain for the horse and it can cause an infection. So this is another reason why we need to be very careful with our teeth, and they need to be examined carefully so that we make sure that we don't miss that if there's any disease that affects any of these, the pulp horns here, the live part of the tooth. So then finally, horses chew in this pretty neat kind of almost figure of eight pattern. Some horses chew more on the left side or the right side, just like people. But this kind of figure of eight pattern and the way they chew affects how they wear their teeth, and then also affects what things that we do with floating. Also to note, horses' maxilla or their upper jaw is wider than their mandible or their lower jaw. So because of this, they get sharp points on the outside of their, or the buccal side of their upper cheek teeth, and they get sharp points on the lingual or tongue side of their mandibular or bottom cheek teeth. So, as an overview here, regular oral exams, the goal of them is to identify and correct problems early, to improve feed efficiency, to prevent oral pain, to prevent oral disease from affecting performance, and then to prolong the life of the horse and the ability to chew hay. So to do an oral exam requires a veterinarian, it requires sedation, it requires a speculum, it requires an oral mirror or an oroscope or oral endoscope, and then you need probes to be able to probe what you're finding. What I always explain to horse owners is I think we're all used to going to the dentist, and you're supposed to go at least twice a year, and whenever we go to the dentist, the dentist will do an oral exam, and they use their mirror, they use probes, they palpate your neck, they ask if you have any concerns. So just the same with dentistry here, with equine dentistry. The other thing is if I would like to know if any of you go to the dentist and lay in that chair and then throw your head around and do like figure of eights with your head while the dentist is trying to look in your mouth. Your dentist would have some very choice words for you. And then also you can imagine if you were trying to look in, if you were in the dentist position and trying to look in their mouth, if you were shaking your head and moving all over the place, it'd be really hard to do a good exam. And from what I showed you earlier with those pictures of all that very detailed anatomy, if you're moving or your patient is moving and not being cooperative, it's gonna be really hard to get a good look at all that very fine anatomy, and very, very subtle problems can turn into really big problems. So that's why an oral exam is such an important part of what we do. And it's really important that all aspects of the mouth are looked at, and that we have a cooperative patient who's not stressed out to do that. So the picture on the left there is using a mirror to look at the surface of the teeth. Here, the picture on the bottom is using an oral camera that I have to look at the surface of the teeth. That is cool because I can record videos and pictures, which you're going to see in this presentation. And then that's an example of a fractured tooth that we can see so nicely with the oral endoscope. And it's great to be able to document changes in the exam to show owners, to show other veterinarians. So having a way to document your exam is really important too. So these are the five parts of an oral exam, and we're going to go through them, and also some common findings with these different parts of the oral exam. So first we have external exam, we have oral soft tissues, we have occlusion, we have endodontic status, and periodontic status. So we're going to talk about each one of these parts of the oral exam and some things that can go wrong with each one of them. So this is a video, it's actually a reel that we had put together for social media that shows a normal oral exam of a horse, or the intraoral part of it, both with the top part of their mouth and the bottom. Let me see if I can get it to play here. So it's a lot to take in because it's like two screens going in at once. But this is what an oral exam with the mirror part of it looks like. And again, you can imagine if a horse was moving or if you didn't have a nice bright light, it'd be really hard to see. So here I'll play it again. But the top video is what the top part of their mouth looks like, and the bottom video is what their mandibular or bottom cheek teeth look like. Okay. So we start with the external exam. So if you see this horse has a unilateral or has a one-sided nasal discharge, particularly a one-sided nasal discharge can be a sign of sinusitis. And the most common cause of secondary sinusitis is dental disease. So there's just a thin sheet of bone that separates the roots of their teeth from their sinuses. So if a tooth gets infected, it's not a far distance for the bacteria to travel through that thin sheet of bone, that alveolar bone, and then enter their sinuses. Then once bacteria in their sinuses, it's a really ideal environment for bacteria to grow. Then we have this horse. If you look, he has this swelling on the side of his face. So again, looking at on the external exam, we're looking for lumps and bumps. We're looking for any muscle atrophy or hypertrophy. We're looking at their lymph nodes to see if they have enlarged lymph nodes, just like your dentist would do with you. All of these can be important indicators of dental disease. Then we look at oral soft tissues. So this horse has a sharp enamel point here that's causing that buckle, that abrasion in its cheek. And you can imagine this would be painful for this horse. There's also a fractured tooth there, but that sharp point is causing that oral laceration. Then in the next picture here, you can see this big laceration in this horse's tongue. He didn't want to eat. And the reason he had that laceration in his tongue is where that or arrow is pointing. He had a recently fractured tooth that had broken off and then was cutting into his tongue there. Then this picture, that red looking blob there, that was a tumor that we found in this horse's mouth. So again, you're not going to be able to find this without doing a good exam. And then this horse presented because he wasn't eating very well. The interesting history with him is he was in this horse had some arthritis issues, some lameness issues. So he was being given the injectable form of Banamine or Flunixin orally, which folks do, but the problem is that solution is very irritating, especially this horse had been on it for a long time. So it was causing all these ulcerations on his tongue. So these are all different parts of the mouth that we look at when we do an oral exam. Look at oral soft tissues. Okay, so then we'll look at occlusion. So if you look at this horse, you can see his incisors are kind of at an angle. We call this like a diagonal incisor bite. What's cool about this is, and this is a horse with a similar type bite. If you look at this horse, you can see the angle of his teeth don't quite match up. On one side, it's a little bit flatter and one side is a little steeper. So they found horses that have this kind of occlusion or like a diagonal incisor bite. It's actually because they have a very slight wry nose or curved nose. So their whole nose is actually curved. So this is important because cosmetically, sure, if you were to just like kind of chop these teeth off to make them perfectly level, they would look prettier. But if you do that, you have a really high likelihood of cutting into the live part of the tooth, that pulp horn. And if you do that, you could cause infection and pain for the horse. So knowing that this is a conformational abnormality in this horse, and as long as he can move his jaw from side to side, okay, then we can usually leave these. But it's helpful, subtle things like this with occlusion are important to note and to know why they happen. So this horse, you can see he has this big hook or over long part of his tooth. This horse probably has, the reason this horse has this is because his maxilla or his upper jaw and his bottom jaw don't quite line up perfectly. So they're supposed to be kind of on top of, line up perfectly on top of each other. But in this case, this horse's maxilla or his upper jaw is a little bit in front, is set a little bit in front of his mandible. So without regular dental care, he's going to get these overlong, this hook here, this overlong tooth. So a regular oral exam and odontoplasty or floating is going to hopefully catch this. They usually have, if they have this issue in the front of their mouth, they usually have the same issue on their last lower molar. So it's relatively easy when you look in your horse's mouth and he has a hook like this, you can see it, and that's fine to, and that gets addressed. But if your horse isn't sedated and have their mouth open with a speculum, then it'd be really easy to miss if they have the same sort of issue, the same kind of hook, except on their last lower molar. And when they get hooks like that on their last lower molar, it can definitely affect performance, especially like in dressage horses or horses that are in kind of a frame. It's hard for them to move their jaw, their upper and lower jaws sort of forward and back if they have these big hooks. So again, you need a nice sedated oral exam to be able to see subtle things like this. This isn't so subtle, but it is subtle in the back of the mouth. Then this horse, you see this circled area. So this horse actually had an extra tooth. And so his on his upper jaw there. So they're trying to fit in an extra tooth when there really wasn't space. So then it was causing this issue. This is an oral soft tissue issue here, but this oral ulceration. Addressing to see the health of this tooth is important. And then if the tooth itself is healthy, if it's just tall, reducing this overlong tooth is important. If you notice, this is at the very back of his mouth. So it's going to be, or this tooth is the very last tooth in his mouth. So again, if this horse isn't sedated with his mouth open, it's going to be really hard to address this. So then occlusion, we have overbites and underbites. The horses that we ride with these kind of conformation can do fine with regular dental care. Again, a horse in the wild may not be able to do so well, but we can manage these and their associated issues pretty well now. And then this is another type of malocclusion. So this horse has their teeth are supposed to line up as one straight like block of tooth, their cheek teeth are. So if one cheek tooth is kind of tilted to one side or the other, that's a malocclusion. And then what happens is food can get stuck in between their teeth because their teeth aren't fitting perfectly together as they're supposed to. So that's another subtle thing that we look for when we're looking at occlusion. So then another part of oral exam that we look at is endodontic status. So this is a normal tooth. If you look at, he has these little brown areas around the periphery of the tooth. Underneath there is the pulp horn, or that live part of the tooth. So if we're looking at a tooth that's diseased, we especially want to know if those little brown areas are affected. Because that means it's more likely to be affecting that live part of the tooth versus if the horse has a fracture that's just over here and not quite involving those brown areas. So this is the same horse. This is the tooth on the other side. You can see this is all with those little red arrows are actually pointing to food in there. So this tooth was very diseased. This tooth was full of food and had an abscess associated with it. But if you notice, again, this is can be a really subtle finding if you aren't looking carefully for it. Oops. So then this tooth has a lot going on. There's a lot wrong with it. One, it's fractured. The red circle is the fractured part, and actually you can kind of see in the distance, this is the fractured part was actually cutting into his cheek. So he's very unhappy. And then in this horse too, where this food is stuck, that is again, the underneath there was the live part of the tooth. So this tooth was definitely not vital or dead and had an abscess associated with it. The tooth was full of food and was actually kind of just crumbling because it was so diseased. All right. Then this is a little bit more of a subtle finding. Instead of these areas are supposed to be stained brown. And if you notice in this horse, instead of being stained brown evenly, it's speckled brown, but then it's still kind of yellow. So this is a different kind of dentin that has been laid down over those pulporins. That's called reparative dentin. So what this tells me is this tooth suffered some sort of insult in the past, and it laid down abnormal dentin over those pulporins because it was trying to respond to the trauma here. So this doesn't necessarily mean this tooth is dead or needs to be extracted, but if something subtle is going on, if the horse has a sinus infection, you're trying to figure out why, or if it's having some sort of subtle performance issue and you think it might be oral pain, seeing a tooth further investigating with radiographs, a tooth like this would be a good idea. So then we have a bunch of fractured teeth. That's also what we assess when we're assessing endodontic status. So this tooth has a fracture here. This tooth has a little uncomplicated or very minor fracture right there. This tooth has a fracture similar to the one that I showed you in the last picture, just the tooth isn't so diseased. And you can see it must have happened recently because there's that red bit of granulation tissue there as it's trying to heal. And then this tooth fractured right in half. So this one probably needs to be extracted. What's cool about horse teeth is they don't always, just because a tooth is fractured doesn't always mean it needs to be extracted. Sometimes they can essentially give themselves a root canal. They can lay down reparative tissue to help heal the tooth, and they don't always get infected. But certainly, depending on how a tooth is fractured, and the health of the rest of the tooth, radiographs are always a great idea, and we can really help stage or assess the rest of the tooth. Again, just like when you go to the dentist, they take routine survey radiographs, and unfortunately, we don't always get to do that in horses. But certainly, if you have an issue, if you remember that picture that I showed you at the sort of more of the beginning of the presentation of that really long tooth, there's only a small part of the tooth that's actually in the mouth. The rest of the tooth is below the gum line. So we really can't assess it at all unless we take a radiograph. And then this is a young horse that had a swelling on the side of its head. His teeth look a little different because they just recently were erupted. But here's a probe probing into that live part of the tooth, which is actually full of food. You can see a little bit of green stuff coming out there. So this horse had an abscess coming because food had gotten into the tooth here and caused an apical abscess. So, and if you notice, I'm using a probe similar to what your dentist used, just a really long version. So we have the same instruments, just big horse versions. Okay, so then finally we're going to talk about periodontal status. So usually in horses, you've probably heard of periodontal or gum disease in people. Horses get it too. It's actually one of the more it's actually one of the more painful diseases, especially that older horses experience. It certainly happens in younger horses too, but it's common in older horses to have issues with periodontal or gum disease. That's because as horses age, their teeth get narrower. And as I mentioned before, horses' teeth are meant to work as this one like block of tooth. So if their teeth are getting narrower, they develop gaps between their teeth. And then when they get a gap between their teeth, food gets stuck in that gap. And then unfortunately, because they can't floss, the food will get stuck in there, and then more and more can get in that gap. And it can cause bone loss and infection around the tooth. So if you can see in this picture, there's a gap, or we call that's a diastema between the teeth. And then there was a lot of food stuck in there, which I had cleaned out, and you can see the tissue is kind of red and irritated underneath where that was. So there's the arrow pointing to that. So this was a mini that had a variety of issues. But as I had mentioned, his teeth, he didn't have good occlusion. He had a lot of crowding. So his teeth, he was trying to fit the same number of teeth into the same space as a big horse does. And his teeth are smaller than a big horse teeth are, but unfortunately they're not proportionally small enough sometimes. So minis are notorious for having issues with crowding. So this mini had a lot of crowding, so his teeth aren't lined up in a straight line. They're kind of all sort of a little bit crooked in his mouth. So because of that, he has a lot of, you can see all the food stuck between his teeth. So this ends up being really painful for them and can cause infections in those teeth. So I'll play it one more time. So that tooth looks okay. That one is a little rotated. That one's like way off to the side. This one's way off to the side. And then this one's, those two are okay and okay occlusion, but there was the gaps between all the others. So that ends up being the issue with them. All right. So this slide, I just wanted to show you how periodontal or gum disease, again, really is affected or goes hand in hand a bit with malocclusions. So this first picture, you can see his this second premolar here is tall. It has like kind of someone had tried to grind down the hook that was here. So that is something that can be addressed. But what it's doing is it's causing this gap between his teeth here. So what's happening is this hook catches when he chews because it's kind of sticking out and it's pulling this tooth forward. So then because this tooth is getting pulled forward, it develops a gap in between a gap is happening between these two teeth, and then food gets stuck in there. And then once food gets stuck in there, then there's bacteria and infection. So periodontal disease and occlusion sort of go hand in hand. This is another horse. You can see there's this overlong point here, which is causing this like laceration in his cheek. So that's painful. But it's also causing this gap to develop. So then food gets stuck here and then he's painful here. So really, these are kind of subtle findings, but doing small changes for this horse, like addressing this tall spot here, will make a big difference in this horse's life, because if he doesn't have this tall spot, he won't have the points associated with here. This will heal, and then also this will have a chance to heal because this is acting like a wedge driving these two teeth apart. So if we get rid of this wedge, these two teeth will kind of shift back together. So these are all kinds of cool things that we see in their mouth and problems that we can solve when we have a good look. And then here's an example on a skull. Again, if you notice right here, there's a tall spot. So that tall spot is acting like a wedge and driving these two teeth apart. And then on this skull specimen, you can see the bone loss that's happened here. That's because when this horse was alive, this gap was getting completely full of food and then was causing bone loss and infection around these teeth. So it really is, when you look at skull specimens that had periodontal disease, it's really cool. But yes, to manage this, even just by reducing this little area, will help this heal. Okay, so floating. So people always ask where the term floating came from. It's actually an old masonry term. As I was referencing earlier, we used to think of teeth were like stones, but teeth are not stones at all. So to float stone meant to level stone. So that's why, hence leveling teeth. So what happens is horses have they're called cingula, these little sharp edges that they get on the sides of their teeth. So when we float those, we reduce those sharp points. And then with floating, we also will reduce malocclusions. Like what I mean by that is mostly overlong teeth or like tall spots that will reduce that. That's what floating means. And reducing hooks like these. And then again, we talked about, here's another more severe example of these diagonal incisor bites. You have to be really careful where, sure, you could completely level this and make this look pretty, but if you were to do that, you would likely cut into the live part of the tooth. So this is just, with floating, you do have to be careful that you don't it's not overdone, and that that the live part of the tooth isn't violated. And then this is a horse with a bit of a wave mouth. So you see he has a tall area here. So when we do this horse's odontoplasty or floating, we're going to try to very carefully reduce this tall spot here. So again, we have to be careful that we don't cut into the live part of the tooth, and this probably is going to have to be reduced in stages. So we'll do what we can in one visit and then have to come back in another 4 to 6 months to reduce a little bit more. Um, but this is what we look at when we're floating. And this is kind of what that looks like here. This is the same horse as in this last slide. So you can see the sharp points here, and now those sharp points are gone. This is just an example of one way of doing this. There's a lot of different ways that you can float teeth, from very basic rasps to all kinds of different powered instruments. So, and instruments on motors and different things. So people also ask, like, what's the difference between floating with an instrument that has power versus floating with a rasp? So while certainly both can accomplish the job of reducing those tall points, a motorized instrument can be a little bit more precise. So, if you think about when you use a rasp, you have to move the rasp back and forth out of a larger area in order to reduce a point, versus a motorized instrument, depending on what the disc or the head is of it, you can place it very accurately on just a single, like I can with my instrument, with my power floats, I can put it on just a single point or a single tall area. So it's much more accurate. As with anything, you can definitely do damage with hand floats. You can do terrible soft tissue damage. You can definitely overreduce with hand floats. Obviously, the same is possible with power floats, but just like with many things, it's all about the skill of the operator here. And certainly in my hands, I can be much more accurate. I can visualize what I'm doing when I'm using a power instrument, and I can be much more precise. So that's why I choose to do that. But those are sort of the differences between those two methods. And then one other disease that I just wanted to mention as we get to the end of the presentation here is EOTRH. If you haven't heard of it, this is what that stands for, is equine odontoclastic tooth resorption and hypercementosis. It was named by a German guy who was exactly describing the disease process. So what happens is their teeth resorb, or basically dissolve, and then they'll lay down more dental tissue trying to build up what was lost, with called that's hypercementosis. So cementum is a normal part of tooth. The problem is it's being laid down where it's not supposed to be, and it's much more brittle than what was there. So this radiograph is a normal, and horses usually get this disease with their incisors, sometimes with their canine teeth, fortunately relatively rarely with their cheek teeth. But this radiograph is a normal incisors, what they should look like. This is a horse, and then this is a horse with EOTRH. You can see, you can see its gums are red, and it has gingival recession. It has some these are called periolis lesions, or they're basically pimples or draining tracts because these teeth get infected. And then on radiographs, these black areas, that's tooth resorption. So that's the tooth basically dissolving. This tooth here is fractured. There's all these black spots in here. This one's already fractured, and there's just a little bit left of it. And then here's another horse with this disease. You can see the really bulbous appearance to his gums. Up here is, again, one of those periolis lesions or pimples, and this is what his radiographs look like. He has a lot of that hypercementosis, so his incisors look like drumsticks here, and he has some tooth resorption as well. So this is a disease of mostly older horses, though when they've done like survey radiographs, they've found it in, like 15-year-olds and things. But it is a painful disease. It has a very gradual onset. But so sometimes owners don't notice that their horse is painful because it's been gradually happening for years. And I think if the pain happened overnight, then a lot more horses would go off their food right away. But because it happens so gradually, I think horses just kind of learn to deal with it. But once we've treated them, we often get feedback from the owners that they didn't realize how painful their horse was and how much happier they are now that the diseased incisors. So the treatment for this disease, and then there's the hypersegmentosis. So the treatment for this disease, since we don't unfortunately know what causes it, the treatment is to extract the affected teeth, which means often we end up extracting all of their incisors, which I realize sounds very drastic, and owners often understandably are very concerned about it. But horses do great without their incisors. They use their incisors for grabbing or prehending their food, and they can do that just fine without, they can use their lips to do that. They don't need their incisors. So this is a video of, let's see. There. So I can turn the volume down. This fellow has no incisors, and if you wouldn't be able to tell if you watch him graze, he can graze and just fine. If you can see, he's in good weight. So these horses can eat just fine without incisors, and they're often much happier, and they often gain weight because it's no longer uncomfortable for them to eat. So finally, signs of trouble. I think the most important thing I want to stress to you is that maybe none. Horses, I know there's many things that they're not stoic about, but they tend to be very stoic about dental pain. So just because your horse doesn't have any clinical signs doesn't mean that he doesn't have any dental disease. But certainly other ones are dropping feed or quitting, abnormal chewing, weight loss, long stems or whole grains in their manure, head or tail tossing, difficulty with contact, resisting, stopping or turning, rearing, nasal discharge, heads swelling on their head or bad breath are some of the many signs that we see with dental disease. So that's all I have for this evening. So just this is my family. Last weekend we got one last ski trip in, so which was fun. But this is how to get a hold of me. But if you guys have any questions, you want to let me know.
Thank you so much, Dr. McAndrews, for a wonderful talk. So now it's your opportunity to ask some questions. Go ahead and use that Q&A feature. If you were on Facebook Live, please ask your question in the comment section.
And we did have one comment in Facebook Live, and that was just inquiring if you could do root canals in horses.
Oh, that's a good question. Well, first of all, it depends a little bit on what tooth. Incisors only have one pulp canal, and it's definitely very possible in incisors. Sometimes it's not realistic, but it's certainly possible. Same with a canine tooth. There's just one root canal or one pulp canal there, so you could certainly do a root canal on a canine tooth. Cheek teeth get a lot trickier because those teeth have anywhere from 5 to 7 pulp horns. So you'd have to, if you're going to do a root canal, you'd most likely have to do it. And their connections are a little variable, but you would have to do actually somewhere between 5 and 7 root canals. So there's certainly people out there doing it. And I think doing it will definitely get even more common in the course of my career here. But it can be possible, but it's very tricky and it's limiting because the technical difficulty of it.
Kind of a little bit of a follow-up here. So Tammy has a horse that actually has several fillings already, and just wondering, what does she need to do about that as he ages? Is there?
Sure. So there's a couple different, there's root canals, and then there's fillings or restorations. Root canals are in the pulp or where the pulp or the live part of the tooth was. Restorations are in other parts of the teeth. And so they definitely need to be monitored for the life of the horse. We do fillings because they get some horses certain parts of their teeth get cavities or caries, and we're trying to prevent those caries from progressing to the point of fracture. So you're definitely going to want to have a veterinarian assess those who's experienced in dentistry so they can look out for those. Ideally, periodic radiographs so that they can monitor the health of the tooth, like of the roots and things. But that's cool that your horse has some fillings.
Another question is, could the slow feeding hay nets cause damage to a horse's incisors?
That's a great question. Really good question. Glad you brought it up. So we see horses with all kinds of wear on their incisors you see horses with wear from cribbing to horses with wear because they wear their teeth down like a single bar in the front of their stall. Certainly see horses with wear from slow feeder, from grazing muzzles and things. So the good news is they can wear their teeth down with those things, but usually they're wearing them at a slow enough rate that the body will have time to lay down more dental tissue over the pulp horns. So the pulp horns usually don't end up getting exposed from that wear. So it usually ends up being fine, even if they have kind of funny looking incisors because they've been wearing them on, a grazing muzzle or a slow feeder or cribbing or something.
Um, so Margie just recently purchased a horse that was unable to eat, and her tongue was hanging out the side of her mouth, and she was drooling. Their vet found a large swelling under the tongue, which
Mhm.
went away with antibiotics and pain meds. What could have caused something like that?
Oh, I'm so glad your horse got better. Like infections in those areas can be tricky. So most commonly it's from there was some sort of small wound there or something pricked him. He ate a sharp piece of something that poked under his tongue, and then that little small puncture wound got infected and then caused an abscess or infection in the area. So those can be tricky, and it's not uncommon for that to happen. And they usually are very painful, which it sounds like your horse was. So I'm glad that Margie, your horse is feeling better. But yeah, it probably was something silly, whether it was like a stick or really, really some sort of weed. I mean, they can even get wires in their tongue, though that wouldn't have gotten better. So on its own. So all kinds of things that they can get in their tongue.
Holly has a question. Is it more difficult to age a miniature horse by their teeth as compared to other horses because she was told that they do not wear their teeth the same? Is that true?
Yeah, so minis are kind of on their own, they're their own deal. Their teeth they kind of usually end up tricking you by their teeth look younger than the horse actually is. Aging in general is sort of a uh I want to say art, but I would say more guesswork. So there are some guidelines for aging teeth, but there's a lot of individual variability in how horses wear their teeth and what they're being fed. And then minis sort of have their own little thing too. Their teeth look younger than they actually are often. But aging horses in general is a really tricky thing, and I hate doing it because it's easy to be wrong, but we're all essentially just making our best guess. It's easy until age 6, and then after that it gets hard.
Connie has a 26-year-old gelding that has his teeth checked or floated each year. But this year, she was told that his molars are shorter. She occasionally sees one or two quids of hay, but he's not losing weight. Should she be concerned?
That's a really good question. So as they age, as those teeth are sort of nearing the end of their life and their teeth have gotten to the point where they're pretty short, then they stop erupting or stop erupting, or they are erupting, but erupting very slowly. And then also what will happen is the surface of their teeth will get smooth because they've kind of worn out the rough part of their tooth. So sometimes those horses don't need to be floated as often just because their teeth are erupting very slowly and they don't develop those sharp edges like a young horse does. And then the reason they kind of can quit or drop food sometimes or ball up hay is because actually the surface of older horses' teeth gets smooth. It's not rough like young horses. So what I tell people, it's like the difference in trying to chew. Think if you're trying to grind up hay between two like stone mill blade, like two rocks, basically, that you could see, milling hay, grinding up hay versus two planes of glass, so once the horse's teeth get smooth, it's like trying to grind hay between two planes of glass, and it doesn't really work very well. That's also why sometimes you notice in older horses, they'll make like a squeaky noise as they chew, again, because their teeth are smooth. So they're like trying to grind up this rough hay with these like two very smooth surfaces. So, in anyways, so you don't need to be concerned, but it is good to continue to have oral exams to make sure they're not developing gum disease or no teeth are getting loose or anything.
Wonderful. Chris, do you have anything else on Facebook Live?
Nope, I think we are good there.
Okay, well, we have two prizes to give away, and let me share